Welcome back to Heart Attack Awareness. Before we dive in, please subscribe, especially if you've ever ignored a little ache and chalked it up to stress or muscle pain. This channel provides life-saving insights every week that help you, and those you love, recognize the early signs of a heart attack before it's too late. Today's topic may surprise you. The most telling pain before a heart attack doesn't always show up in your chest. In fact, the signal that matters most often appears in places you never expected: your jaw, arm, back, or even your teeth. Recognizing these unusual signals is crucial because by the time chest pain arrives, it may be too late. 1. Jaw or tooth pain that has no obvious cause. Imagine waking in the middle of the night with a stabbing or dull ache in your lower jaw, or even your teeth with no toothache or dental history. This is often dismissed, but it's a classic warning sign for heart attack, especially in women. Referred pain from the heart travels along the same nerves that supply the jaw. If you notice persistent or unusual jaw pain, especially combined with exertion, dizziness, or sweating, don't wait for chest pain to appear. This is often your heart sending a discreet SOS. 2. Shoulder and arm discomfort without injury. Pain or tingling down the left arm, especially inner side or between thumb and forefinger, can be an early predictor. People often think it's pulled muscles or pinched nerves from poor posture. But unlike mechanical pain, this heart-related discomfort is deep, dull, sometimes stiff, and may come and go briefly. The difference: it doesn't respond to stretching or massage, and it often flares up during exertion, cold weather, or stress. When you feel this, especially without a clear cause, treat it as a red flag. 3. Upper back ache between the shoulder blades. Upper back pain that starts with no injury can be heart-related. It usually resides between shoulder blades and can be uncomfortable in positions like bending forward or lying down. Frequently, it's accompanied by fatigue, sweating, or a subtle chest uncomfortable. It's not just muscle. It's referred pain from the heart, your cardiac plexus designed to stop damage before it becomes catastrophic. 4. Neck and throat discomfort. Aching or pressure in the throat or low neck region, especially when swallowing or turning, could be a sign of heart ischemia. It feels tight or burning and often arises with light activity or during stress. It may lead you to see a dentist, ENT, or chiropractor, when instead it's your heart that needs attention. 5. Abdominal discomfort or indigestion that isn't GI-related. A sudden feeling of fullness, nausea, or mild pain near the upper abdomen or heartburn sensation might actually stem from your heart. Again, it's nerves sending pain signals to your GI region. Antacids won't help, and it often arrives along with other subtle symptoms: fatigue, lightheadedness, or cold sweats, especially after meals or exercise. It's important to heed this warning and not dismiss it as indigestion. 6. Radiating pain that moves or flares without gray zones. Unlike mechanical pain that stays in one spot, this pain can shift from jaw to shoulder, then to the chest or back. It may flare quickly under stress or movement. This shifting, migratory quality is a hallmark of referred ischemic pain. That's your heart asking for help in multiple inconvenient ways. Real-world stories. Karen, 52, woke with a dull ache in her jaw and shoulder after gardening. Not heavy work, but when she bent down. No dentist connection, but within hours, chest pressure arrived. She got help early because her pain felt unusual. Marta, 60, ignored throat discomfort and indigestion for days. Believed she'd eaten something weird. When her arm started tingling at night, she recognized this video's pattern and went to the ER. She had 90% blockage in her left anterior descending artery. Why this pain happens. When blockages build, parts of your heart muscle receive less blood. Nerve fibers from those areas share pathways with other parts of your body. This is called referred pain. Unlike direct chest pain, these sensations signal early, before heart muscle damage becomes extensive. What to do? Pay attention to unusual aches, especially around jaw, arm, back, throat, or belly, when they come without reason. Check if pain rises with modest activity or stress. Combine with other subtle symptoms: fatigue, dizziness, sweating. Call emergency services if pain persists, returns frequently, or occurs with shortness of breath, nausea, or unusual tiredness. Ask for ECG, troponin tests, or a cardiac stress test, even if chest pain is mild. Prevention and testing. Keep an ECG stress test every 2 to 3 years after 45, more often if risk factors. Consider CAC scans if you have family history or risk factors. Track subtle aches in a journal. Use wearable trackers for irregular heart rate, especially at night. Lifestyle: sleep, movement, anti-inflammatory diet. Closing thoughts. Your body speaks. It doesn't only use chest-crushing pain to get attention. When your jaw aches, your back tightens, or your throat burns, listen carefully. You could be hearing a signal your heart needs. I've worked in medicine for years, and these subtle signs are often dismissed until it's too late. Thank you for watching Heart Attack Awareness. If this video helps you, and more importantly, someone you love, please like, share, and subscribe. The next video in this series will teach you the emergency test you can do at home for your heart, if you haven't already seen it. Stay alert, stay safe.